Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about central sensitization and what it is and how does it relate to pain either before or after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on those notifications so you can catch all of our latest videos, including exercises, frequently asked questions, all the details of rehab and recovery. So, first of all, what is central sensitization? What is this kind of fancy word? You may have heard of it before or may have heard something similar to this, or maybe you haven't at all. So when it comes to pain in your knee or any part of your body, either before surgery or after surgery, there are going to be multiple factors and multiple things that play a role in the pain and the symptoms that you experience. So just a couple examples such as psychological factors, maybe anxiety, depression, fear of movement. There are factors of the soft tissue, so what's going on with the muscles and the tendons and the ligaments. And there's things like swelling and edema in and around the knee joint that play a role. When it comes to central sensitization, what's going on is changes in your central nervous system. So we're talking about your brain and your spinal cord, the central part of your nervous system and the nerves. And so what's going on is there's a change in the processing of pain. So what really, after you have a knee replacement surgery, after about, let's say approximately 12 weeks, your knee and the structures and the tissues around your knee are essentially healed to very close to what they're fully going to be healed. Now, this doesn't mean you don't still have pain and symptoms, but really things are really starting to heal. The healing process still goes on for up to 2 years, but really the main bulk of the healing and the recovery and the repair has really happened in those first 3 months or so after surgery. But so why do we still have pain? Well, one possible reason is this central sensitization. And what it is, it's a change in how your nervous system and how your body is processing pain. And what I mean by this is prior to surgery, and then of course after the surgery, you have been getting tremendous amounts of pain input. So tremendous amounts of pain, discomfort, symptoms, stiffness, achiness, swelling, all of this input, all of this irritation and pain and discomfort. Kind of almost like an overload to the system. And what happens is your central nervous system, your spinal cord, your brain, your nerves, they have become sensitive to this input. So they've kind of trained the body to react and to recognize this pain and this input a lot more efficiently, a lot more quickly. So it's become what people like to call hypersensitive or hyperexcitable. Basically, you have less of a threshold or less of an amplitude of an input to lead to the body giving you this signal of pain and symptoms and discomfort. So essentially what's happened is the body has become really good or too good at experiencing pain or responding to inputs that may be painful or may be threatening. And so it's basically a reduced pain threshold. And what this means essentially is your central nervous system, your spinal cord, your brain, your nerves have formed this pain memory. So that anything that happens that the body or the brain is telling each other, this input and this has become so sensitive and it doesn't stop that you're experiencing pain now when really a normal, functioning person would not experience pain or experience discomfort with the type of input or the type of movement or activity that you're doing. And so what do we do about this? What do we do about this hypersensitivity, this central sensitization, this hyperexcitability of the nervous system and of your body? Well, the first thing is we have to understand that when we have this pain and this discomfort and these symptoms, it doesn't necessarily mean that anything harmful is going on or there's any damage or injury occurring to your knee or occurring to your body or the soft tissue around your body. The main thing that's occurring is that your brain is just signaling that, warning. It's that alarm system, that danger system is saying that there's something going on to be careful. But that threshold where you're actually causing injury or harm, we're not even close to reaching that threshold with what you're doing mostly. And so that's the first thing is you want to take comfort in that even if you're having these pain and symptoms, it's very unlikely that you're actually causing harm or damage or injury to the knee replacement or any of the structures around your knee. The second thing to keep in mind is the pain from your excitable central nervous system is something that your body has learned. It's something that your body has kind of adapted and trained itself to have this hyperexcitability. And so in the same way that your body has trained and become more sensitive to pain inputs and pain signaling, we can train the body and retrain the body in the opposite direction. So what I mean by this is we start to train the body that certain activities, certain regular day-to-day things like walking, like going up and down stairs, like laying down in bed, these things are not harmful. They're not things that we have to be on high alert and hypersensitive to. These are perfectly okay, and they're not going to cause any harm or damage to the body. And the way that we retrain this is that we do it through movement. We do it through movement of the body. We do it through participating and progressively getting back into these different activities, whatever they may be. So part of it may be just doing your normal day-to-day activities as much as you possibly can. You know, if you experience pain, you experience discomfort, you can acknowledge it. You can say, okay, well, I know this isn't harmful, this isn't bad, so I'm just going to kind of keep going about my day and trying to do the best I can. If the pain gets super, super high where it's intolerable, I'll take a break. But if my pain's in this manageable level, I'll do what I can and try to carry on with my day-to-day. And so through doing that progressively and slowly over time and with patience, we're going to start to retrain the nerves. We're going to start to retrain the brain, the central nervous system, to not be hyperexcitable, to not have this hypersensitivity to different movements, different activities. And that's one reason and one aspect, one factor to that pain and discomfort that you may be experiencing, even though you may be months or even years out from having your knee replacement surgery. So I hope this was insightful. I hope this gave you some good tips to help to manage and understand your pain and understand your symptoms a little bit better. If you found this helpful, I'd appreciate your likes, your comments below. If you aren't already, please be sure to subscribe and turn on those notifications so you can catch all of our latest videos, and you can help promote this video and others and get them out to the people who will benefit. Thank you very much for watching.